We're here with our debut episode of Between Two Furs. I'm your host, Brandon Tushek. This is my special guest, Jane Hung,
Hello.
my fiance. Today we're going to be talking about substance use disorder. Jane and I have lived together since before school started, so she knows me very well, and I think it's very appropriate that we're having this conversation because if I was to be going through this, you would probably be the first person to notice. So we'll get started off. What is substance use disorder? So basically, it's a disease of the brain characterized by recurrent use of substances, could be alcohol, drugs, clinical impairment, and functional impairment. So that could look, like not meeting your work responsibilities, my home life or personal responsibilities, things like that.
So you don't take out the trash?
Well, we have valet trash, so I never take out trash. So in this disease, in substance use disorder, it's like a circuit. So there's a reward, withdrawal, and then there's memory and motivation components as well. As that progresses, you can get to addiction, which is kind of like the severe chronic form of substance use disorder. So when you get to the point of addiction, you have substantial loss of control. So despite wanting to stop, you can't. It's just a compulsion, or almost like a second nature. You don't even think about it at that point. This recruits memory and motivational systems as well, but interesting in this, with addiction, you actually have a weakened inhibitory response. So, that little part of you that's saying, I shouldn't do this or whatnot, kind of goes right out the window. Why do you think cRNAs or sRNAs may be at risk for substance use disorder?
They have access to drugs.
That we definitely do. cRNAs especially, so yes, Jack, you mentioned easy access to drugs. cRNAs, most of the time we work alone. So, if we wanted to pull out a drug and, switch it out with, some saline or something like that, and most drugs are clear, it'd be pretty easy to do. Other things are job-related stress. It is a high-stress profession. There's a lot of responsibility, and that can weigh on somebody. We do have an intimate knowledge of pharmacology, which I believe could lead to a false kind of sense of security for experimenting with drugs. Thinking we're invincible or we know how to use them properly, so everything will be okay if we do. Another thing that's tied to any healthcare profession job, or most, is a lack of sleep. A lot of times it's shift work that we're doing, and altered sleep patterns can really mess with, cause some chemical changes in the brain, and maybe not cause you to think as clearly as you normally would. And then just personality. So, as you can imagine, a lot of people in this field can be, the more type A or tightly wound type person, and that may predispose cRNAs as well to substance use disorder. Specifically for sRNAs, things that we're experiencing those things as well, but more specific to us, we have high performance expectations, and like again with those personality traits that we talked about, we expect a lot from ourselves, and so it can be a hard transition, because when we were working in nurses, when I was an ICU nurse, before I started school, I was like at the top of my field. I was experienced, I knew what I was doing, and then I go to this role where I'm a novice again. I feel like I know anything. So that can be very stressful. Undergrad, as a nurse in nursing school, I did very well. But, that doesn't necessarily correlate to CRNA school. So, you can get A's in undergrad in nursing school. That doesn't mean you're going to get all A's in CRNA school. And that can be a big stressor for some people. It might be the first time they ever receive something less than an A, and that can be very difficult for them. Of course, there's the financial strain, which you and I know both very well, what comes along with school. UNCG, increase your cost of attendance, please, so we can have a little more comfortable, better living. So the financial strain.
That match.
Yes, if we had increased cost of living, we could have couches that matched, or just one couch, that matched. So yeah, the financial strain, that can be a big burden. You know, school's 3 years. That's a long time
It
to be
is.
without. It's a long time to be without income, which I know you know all very well. So lack of coping skills, like I said, I would definitely say, you know, up until nursing school, that was probably the hardest thing I ever did. And then you get into CRNA school, now this is definitely the hardest thing I've ever done. And, you know, so definitely not being ready for that, you know, that could be an issue. And then decreased time for self and family, you know, less time to spend with you, the dogs, you know, my friends or family, and do the other things I like that help me to reduce stress. Having less time for those things, that can really add up. So some behavioral things are, you know, think of for someone's mood. They could have, you know, rapid mood swings, personality changes, frequent unexplained tardiness. So they're late for things a lot. They're not meeting their responsibilities. Another thing could be like poorly explained errors. So, you know, in the work setting, you know, if someone asks you like, "Oh, what happened here?" and you can't really explain what's going on. You know, obviously, if someone's visibly intoxicated, some other signs could be, you know, wearing long sleeves, maybe when it's not appropriate because they may be injecting something, so they have marks on their arms, or, you know, just you know, more bags under their eyes than normal, or they just appear achy and just uncomfortable. So, talking about interventions now, if I were to, or you were to see someone exhibiting these signs and symptoms, you know, how are you going to go about it? It needs to be very calculated and planned event. I think for me, the hardest thing is I would need to resist the urge to just go deal with it immediately. First thing you got to do is notify you know, notify the right people and get some resources. You can contact the state peer advisor, which just happens to be one of my program coordinators, and also the peer assistance helpline through the AANA. And what these people are going to be able to do for you is just set you up with the right resources to be successful. And you know, not many people are skilled in doing an intervention, so they're going to help you make sure that it goes well. After you contact your state peer advisor or the peer assistance program, you're going to want to focus on getting the person help. That's the main idea. Not focusing on getting them in trouble, or, you know, okay, who do I have to tell at work or something like that. It's really just getting the person help is the main focus. You know, those other things can come later. Always want to rehearse the intervention with the people who are going to be a part of it, because things don't always go as planned. One of the most important parts of the intervention is to never let that person be alone. Who knows what could be going through their mind? So you don't want to leave them alone to prevent them from maybe making a rash decision. During the intervention, you want to have, you know, you're going to have your ducks in a row. So you're going to have your documentation and objective, you know, findings that you've noticed, and bring that forward to the person. I guess, you know, obviously don't be a jerk. The point is to let the person know that you care about them, not that, you know, they're caught or anything, but just let them know that you care about them and you're worried about their health and them getting better. Obviously, the whole point of the intervention is to come up with a plan of, you know, what we're going to do now, and assess the damage, what's going on, and how bad it is, and come up with that plan. Ideally, you know, you could have a bed ready at a facility, ready to take them immediately to afterwards. You'd like to set up a drug testing protocol, so that individually can be escorted for testing. And it is possible that the patient or the person is not responsive to your intervention. They may want to walk out. You know, there's a whole wide range of reactions. So worst case scenario, if they're not willing to listen to you, you can, you know, threaten to call the police. Talked a bit about our state peer advisor. We talked about the peer assistance program, and you can call them anytime, day or night, and get help from them. The person going through who has a substance use disorder, they can contact them just for support as well. And then really the AANA, their website is just a slew of information and resources. What is your takeaway from all this, and what have you gained from it?
Well, if you ever present symptoms like wanting to go in early and trying to take these high-risk cases, or trying to be alone with medication, having sudden mood changes, things like that, maybe suspect that you have a substance abuse disorder.
What about at home?
What do you mean at
I
home?
don't know, like what at home? What do you think you would see?
Not doing things that you normally would, like chores and whatnot.
Mm-hmm.
And some action that we could do is have an intervention with peers, people that work with you, people that are your friends, neighbors, contacting your state peer coordinator. That's new. That's correct. And then who is your programs director, as well as a peer advisor, and getting you the contact information.
Awesome, Jane, and thank you for your time. This has been Between Two Furs,
Between Two Furs.
signing out. Cut.
Video pause.
Video pause. Surrey pause.
Sorry.
Surrey pause. Get it back up there.
This actor is not cooperating. One of my furs is moving. Carl.
This will
Carl.
be in the outtakes.
Carl. Come over here, Papa. Carl.
The important parts of the intervention is to never leave the person alone.
You're saying this like a fire.
Because you keep doing other stuff.
Oh, he's right.
Not looking at me.
Okay, I'm looking.